Hi everybody in Psychology 101. The topic for today is therapies. So I'm going to go over the skeleton notes, which as usual should be the same as the PowerPoints and should be consistent with the book. Therapies usually implies talking to someone, having the skills necessary to help them through their problems by knowing what to help them with, how to say things, how to work through their issues, things like that. But it can mean other things too. Therapies can mean medicine, changes in lifestyle, and even medical procedures at times. So let's get started. Talk therapy, also known as psychotherapy, can really be put into two broad categories: insight and action. Insight means you want the person to learn about themselves. Why do I act this way? Why do I think this way? Why do I feel the way that I feel? Gain insight, learn about themselves. Whereas action therapies, you want the person to do something differently. Of course, a therapy could be both of those things, but those are two broad categories. So, within insight, we're going to talk about psychoanalysis. Sigmund Freud came up with this, and it's actually quite complicated. But I just want you to know two things for the exam. There are many, many more parts of Freudian psychoanalysis. But what I want you to know is how to get to the person's unconscious. You might remember that's what Freudian psychoanalysis is all about in the first place. So two methods of doing that: free association. How many times during the course of a day do you think about something, but you don't say it out loud? Probably a bunch, huh? What if you could, in a therapist's office, you say anything that comes to your mind? You would get to know your unconscious. If you can't think of anything to talk about, your therapist could give you words. Something like table, vacation, mother, and you would think of whatever comes to your mind. Either way you do it, any way you do it, it's free association. Saying anything that comes to your mind to get to know your unconscious. Transference comes from the word transfer. This is really projection, which was covered in an earlier chapter, the theories chapter, about psychoanalysis also. You transfer feelings onto people. You project feelings onto them. So a good psychologist using this Freudian technique would look at, how is this client projecting onto me? Do they see me like a father, like a son, like a best friend, like a lover, like a sibling? When I work with juvenile delinquents, sometimes they see me like a father, in a bad way that I'm too critical of them, or a good way like I wish my dad was like you. That is transference, transferring feelings unconsciously onto people. Next therapy, that's an insight therapy, interpersonal. Freudian therapy, psychoanalysis, can take years to get to know your unconscious, but interpersonal, well, that's much quicker. You only go several times for maybe an hour, and it really focuses on two things: your roles in life. You're a student, maybe you're somebody's sibling, son, daughter. If you have kids, maybe you're somebody's mother or father. You're a friend, you're a coworker. We focus on your roles in life. Not only that, it is brief. It's intended to only go several sessions, and because of that, insurance companies usually like this. They're not paying nearly as much money for you to get past your problems and deal with your issues. Next insight therapy, humanistic. This is another one that comes from a theory, humanistic psychology. And what I want you to know is three things. Abraham Maslow is more well known for the theory, but Carl Rogers was more well known for the therapy, helping people become the best they can be and work towards self-actualization, being the best you can be, just like it sounds. So, according to Carl Rogers, three things the therapist needs to do to help the client be the best that they can be. First one, non-directive. You can Google. If we were in class, I would be showing you little clips of videos, but that's impossible to even post for you because you would have to know exactly like what parts to go to in the video that are Carl Rogers showing these skills. The first one, non-directive. Carl Rogers, if you look up Carl Rogers and Gloria videos, he was on video doing this with a client in the 1960s, talking about being a single mom and starting to date again. He would not give her advice. He said, let's figure this out together. I sure wish I could tell you what's best for you, but you have to figure out what's best for you. Non-directive. The second thing is, you have to believe that all people are good, all people are positive. But wait a minute, how is it then that some people become serial killers and horrible people? Well, their good side maybe hasn't come out like it should. Carl Rogers did believe that there is a good side to all people. Last thing, empathy. You have to have empathy for people and try to feel what they're feeling. Even if someone is really rude to you, you have to have some empathy and try to feel what they're feeling. So the combination of those three factors in the therapist will help the client become more self-actualized. Next one that is an insight therapy, Gestalt. It might sound like it's a person's name, but it's really a German word meaning the whole picture, everything all together, awareness of the whole situation. Gestalt has multiple meanings. So Fritz Perls was the psychologist who invented this, and he believed in a couple of things. One, analyzing someone's body language. He invented that. The way that you're acting, even your posture, or the expressions you use, or what you're doing with your hands at any given moment, he would analyze that. Also, Gestalt therapy would use an empty chair. So it's you, the client, the therapist, and an empty chair. Pearls might have you talk to that empty chair to resolve your feelings. And if you're pretending like it's a person who isn't there, or even part of yourself, you might go sit in that empty chair and talk back to you. Very different, isn't it? And then the third part of total awareness in Gestalt is unfinished business. According to Pearls, we all have this. There are things that have happened in our lives that we have not completely resolved. So you have to look back at those times and say, yeah, I have unfinished business. I'm still mad about that. I'm still upset. And work on those. You've heard of the expression, someone carrying baggage. That's exactly what Pearls was talking about. So moving right along, group therapy. We haven't talked about that yet. All of these therapies we've talked about are one-on-one typically, but they all can be done in a group format. By the way, if you were to go on YouTube and look for those Gloria videos with Carl Rogers, there's another one with Fritz Perls, and a third one too we'll talk about. In 1964, this lady named Gloria got to see all three of these famous psychologists for half an hour each to talk about the same problem with three different approaches. So anyway, within the handouts for this week, group therapy. I would not spend too much time trying to memorize this. Instead, just try to understand that there are reasons why people would rather go to a group. To be around people with similar issues as they have, to get hope that someone else said, hey, I've gotten through this, so can you. Just to learn information, just to get something off your chest, and also the cost. It's usually much less expensive if 8 or 10 people are splitting the cost of a group rather than a person paying for him or herself, and that's especially true when people don't have insurance. Last thing on this topic, family therapy is group therapy. Your whole family goes together. The basic tenet of family therapy is that everyone has the problem. Maybe one person has more issues than the other, or others, like maybe dad's an alcoholic, or your sister has anger problems or whatever. Sure, one person could be more troubled, but the entire family has the problem. That's the basic tenet of group therapy. Action therapies. What I want you to know about this is that the goal is to take action, basically changing your thinking or changing your behavior or both. We're going to start with behavior therapies. The goal is, just like it sounds, to change your behavior. Systematic desensitization. That sounds like a fancy term, but it's really quite simple. Step-by-step approaches to get over a fear or a phobia. So, you're afraid as a little kid to go in the swimming pool? Well, maybe the first day you only have to put your feet in the water. And then the second day, you do have to go in, but the grown-up is not going to let go of you. Well, guess what? Third day you blow bubbles. Fourth day you put your face in the water. You're going to get it eventually. There's programs like this for people who are afraid to fly. The last step is getting on an airplane. The first step is just learning about it. Step by step to change your behavior. Next one, aversion therapy. No, I skipped one, didn't I? Flooding. Instead of step by step, you just force yourself to do it. Get on that airplane, get in the swimming pool, have a spider crawl on your arm, have a snake wrapped around your neck. Whatever it is you're trying to get over, you just force yourself to do it, not step by step. That's systematic desensitization. Flooding, you force yourself to do it and get it over with. Aversion therapy. I almost said this a minute ago, but I got ahead of myself. In aversion therapy, the goal is to get over a bad habit. You eat too much junk food? What if you had to, I don't know, donate $10 to charity every time you had junk food? You eat too much junk food? What if it made you throw up? I bet you wouldn't eat so much junk food. You bite your nails? What if it tasted horrible rather than feeling good? Something negative has to happen to get rid of that habit that used to feel good to you. Cognitive therapy. Instead of the action being changing your behavior, the goal is to change your thoughts. Could it be both? Of course. That's called cognitive behavioral therapy. The only person I want you to know, no names for behavior therapy to memorize, but cognitive therapy, Albert Ellis. So if you were to go on YouTube and look up Gloria videos, Albert Ellis, he has one too. She's the third famous psychologist that Gloria saw, didn't say that quite right, did I? About her dating and being a single mom. He tried to help her change her thinking. Here's how it works with rational emotive therapy. Albert Ellis's brand of cognitive therapy. A, there's an activating event. C, there's a consequence, you're feeling. But wait a minute, what about B? That's exactly what Ellis would say. We usually forget about B. There's a belief in between. So I get an exam back, that's the activating event from my professor, it's a bad grade. My consequence, my feeling, I'm upset. Why? Because of my belief. My belief is that I'm stupid and I'm never going to amount to anything in life. But wait a minute, what if I got that exam back and I'm angry? That's the consequence. The activating event is the same. What would make me so angry? The test isn't fair. This professor is just out to get me. That is a belief. Irrational belief. That is what causes people to react negatively. So obviously the goal, the action, is to make your beliefs more rational and less irrational. Moving right along, there are plenty of medicines. This is an action therapy too. You take medicine to help you with your psychological issues. I'm going to keep this simple, I promise. This is not graduate school. It's not medical school either. Antipsychotic medicines. People with conditions like schizophrenia, antipsychotic medicines help their symptoms. It doesn't cure them, it makes them better, but not cured. Tardive dyskinesia, I'm starting to see TV commercials where they address this. A side effect where people twitch. Their mouths, their necks, their eyes. That is a neurological response to basically overdosing on these kinds of medicines. I would highly recommend anyone with tardive dyskinesia to go right to a medical doctor and say, hey, this is what's happening to me. that person either needs a different medicine or perhaps a lower dose or a combination of medicines. That is a nasty side effect that can be permanent from antipsychotic medicines. Antidepressants usually take 2 to 4 weeks to work. Medicines like Prozac is probably the most famous one. Still, after all these years, alleviate symptoms of depression. That's what they do. However, what it often does is makes people not feel much of anything. So therefore, that can be a stressor when people want to feel more happiness or more emotions, or yes, it can even impact a person's sex life. Anti-anxiety medicines, instead of taking 2 to 4 weeks to work, they work very quickly, 10 or 15 minutes. So what's the good and the bad? Well, it works quickly on your anxiety. That's cool. But the bad thing is they can be very addictive because they work so quickly. Almost like smoking or drinking alcohol. You wouldn't do it if it took a month to feel the effect. People get addicted to things that work quickly. Moving right along, ECT, electroconvulsive therapy. This has kind of made a comeback in recent years. They started this decades ago, and now it's being widely used again for people with major depression, especially when they're suicidal, and nothing else seems to be helping. Shocking the side of their head on one side or the other, and then having them lay on a hospital gurney and putting a plastic mouthpiece so they don't bite their tongue or even swallow their tongue. Believe it or not, that's possible. But the side effect is it gives you a cloudy short-term memory. So some people claim, and we don't know why it works, it helps with their depression. But it really does mess with your memory quite often. Look, in the handouts for the week that are attached in the module, there is a handout about that as well. ECT. Moving right along, I also want you to know about a lobotomy. We don't use this anymore. In the late 1930s, this was invented by a South American medical doctor named Muniz, and he invented this to help people with anger. It's really inhumane. The only way to get to the anger center of your brain, the amygdala, is to go through other parts of your brain. So they would drill through a person's eye socket, the top of their head, the back of their head, and they would destroy important brain parts and processes by doing that. So it would often leave a person vegetative, very inhumane. We don't use lobotomies anymore, but the doctor who invented it won the Nobel Prize for Medicine because they thought he was curing anger. Obviously, it was doing much more damage than it was good for anybody. Last couple of things, psychologist and psychiatrist. It often takes about 11 years of formal education, college and graduate school, to become either one. A licensed PhD in psychology, that's what I have, or a licensed MD to practice psychiatry. Same amount of schooling, but it's broken up differently because psychologists like me, we don't go to medical school. Psychiatrists, they don't get PhDs. Psychiatrists do a 3-year residency. I did 2 years of internships, post and pre-doctoral. I write a dissertation. Psychiatrists don't have to do that. So the schooling might be the same number of years. It's different schooling though. And not only that, it's a different job once you get out. Do you want to prescribe medicine to people and work in a medical type of environment? That's more psychiatry. Whereas psychology, evaluations and counseling, even though you could work in a medical setting, it's just less common. And last thing, effectiveness of talk therapy. This is where we started, psychotherapy. Smith, Glass, and Miller in 1980, by the way, the first two, Jean Glass and Mary Lee Smith, they were ASU professors. And they did a study in 1980 with their colleague in Colorado, Miller, about the effectiveness of therapy. What they found is with 20,000 people, it was called a meta-analysis of data. 75% of these people benefited from getting counseling, and it didn't really matter what type of therapy it was. So this is kind of ironic. We've talked so much about all these different kinds of therapy, and the research says as long as you're getting help, that's far more important than what kind of help it is. So this is the therapies chapter. If I'm not mistaken, we have one more to go about social psychology and relationships, and then that will be it. Until then, we'll be doing one more video and keep doing the assignments and everything else. Don't forget about the paper, and I'll see you on the next video.